Welcome to the Deep Dive. We're here to cut through the noise, get right to the core of complex topics. And today, we're looking at something pretty fascinating, how digital tech and sexual health connect.
Yeah, it's a field that's changing really fast. You've got online services, even AI chatbots now. But what our sources are showing is, well, a really critical shift in how we should even think about being, digitally savvy in such a sensitive area.
Right. So our mission today is to unpack why this common idea, digital literacy, might actually be holding us back when it comes to sexual health, and explore what a new approach, they call it a capabilities approach, what that means for you, whether you're just looking for information or maybe you work in healthcare.
Okay, let's get into it. So when I think digital health, particularly sexual health, maybe my first thought is, okay, someone knows how to Google symptoms or find their way around a health website. Is that basically it? Or is digital literacy a bit more complicated here? Well, that's a good place to start. And what's really interesting is, like you said, the sources show that current definitions, they're often a bit contradictory, sometimes unclear. But yes, they do mostly define it as sort of an individual's ability to seek, find, understand, and appraise health info from electronic sources. Pretty standard stuff on the surface.
Okay, but here's where it gets really interesting, isn't it? This review points out that framing it that way, as literacy, it often points the finger at the individual. A deficit is the word they use. It kind of implies, oh, this is a patient problem that needs fixing. And crucially, it seems to almost ignore the digital skills or lack thereof within the healthcare workforce itself.
Exactly. That's a huge point. And it brings up this question. If literacy is only about individual skills, what about the bigger picture? The system. The source makes this great point that historically the term literacy itself carries some baggage. It connects skills with moral qualities. Think
Right.
about it. We don't usually say a mechanic is car literate, right? It sounds a bit odd.
Never thought of it that way.
And especially in an area like sexual health, which can already feel sensitive or uncomfortable for people, implying there's some kind of deficit in their digital skills if they struggle. That can just push people away, make them less likely to seek information or care they need. It really risks stigmatizing people, and it just completely misses the social factors, the systemic barriers.
So it's less about what individuals can't do, maybe, and more about what the system isn't providing or how it's designed. That feels like a pretty major shift. So what does this mean practically for actually improving sexual health using digital tools? How does this capabilities approach actually, change things?
Right. So connecting this to the bigger picture, this capabilities idea is, well, it's much more holistic. It's more practical, actually. Instead of just ticking boxes on individual skills, it looks at the whole setup, the collective dimension, the systemic parts. Think about it this way. Say there's a digital health portal, right? But it needs super fast internet, maybe a really complex login, perfect eyesight to read the tiny font. In that case, it's not really the user who's illiterate, is it? It's the system itself that's putting up barriers for potentially lots of people. So a capabilities approach pushes us beyond just hoping individuals find good info. It pushes for designing things inclusively, like user-friendly apps built for diverse communities, or critically, training healthcare providers not just to use the tech themselves, but how to actually guide patients through these online resources. In a non-judgmental way, understanding the real barriers people face, the digital divides. It's really about creating an environment where everyone has a genuine opportunity to benefit from digital tools, whatever their starting point.
That makes a lot of sense, and it feels much more constructive. It's encouraging, too, because this lines up with bigger trends we're seeing, right? Things like Australia's Digital Health Capability Framework or the WHO's Global Digital Health Strategy. They seem to be moving towards building a digitally capable health workforce, not just literate individuals. The core idea, and they draw on thinkers like Amartya Sen and Martha Nussbaum here, it isn't just theory. It's about shifting focus. It's saying, look, it's not all on the individual. The whole digital ecosystem, the tools, the policies, the healthcare providers, it all needs to be set up to genuinely empower people, not just the ones who are already tech savvy. So for you listening, whether you're looking up info or maybe working in a clinic, this suggests asking a different question. Not just, can I use this tech? But maybe, does this tech really enable me or my patients to get what we need? Considering all the real world stuff like access, comfort level, existing knowledge. So ultimately, this deep dive really shows us that just talking about digital literacy, well, it isn't quite enough. Not in this complex area of sexual health anyway.
We need to be looking at capabilities, understanding the whole system, the environment, not just whether one person can click the right buttons.
Exactly. And the end goal here is promoting social justice, promoting equity, making sure that this digital transformation actually benefits everyone. Which leaves us with a really important question for you to think about. As these digital platforms become more and more central to how we access sexual health info and services, how can policies and the actual infrastructure be designed to truly empower communities? Especially when you consider things like, say, online content moderation policies, which might even accidentally block access to vital medically sound information, something to consider.